Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This episode is on cholesterol. Abnormal cholesterol is one of the most common medical problems in adults, and it's also one of the most common reasons to be taking prescription medicine. In addition, abnormal cholesterol is a common cause of heart attack and stroke. So this is a really important topic that you need to know about. We're going to be covering what cholesterol is, the causes of abnormal cholesterol, the testing, and the treatments. Now, if you like content like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. And if you have any questions, leave them in the comments and I will answer all of them. Now, before we get started with cholesterol, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having symptoms of a medical problem, or if you think that you have abnormal cholesterol, make sure that you talk to your doctor right away. Now, let's get started with cholesterol. What is cholesterol? In medicine, when we talk about cholesterol, we're generally talking about your lipid panel. A lipid panel consists of measurements of different kinds of fats found in your bloodstream, and they are total cholesterol, LDL, HDL, and triglycerides. We care about these because abnormal levels of these fats in your blood increases your risk of heart attack and stroke. To understand why this is, let's talk about atherosclerosis. So atherosclerosis is the gradual buildup of plaque and cholesterol in your arteries over time as you get older. Atherosclerosis causes the space in the artery to decrease for the blood vessel to become more narrow over time, and it also damages the blood vessel. And this process can lead to the formation of clots and emboli, and these can cause heart attacks and strokes. Let's break down the components of the lipid panel. The first component is total cholesterol. High levels of total cholesterol increase the rate of atherosclerosis and increase the rates of heart attack and stroke. The next component is LDL, which stands for low-density lipoprotein. Of the different components of the lipid panel, LDL is the one that most strongly correlates with heart attack and stroke. So it's very important to keep your LDL within the normal range. The next component is HDL, which stands for high-density lipoprotein. HDL is actually a good cholesterol. It helps to protect you by removing bad cholesterol from your bloodstream and from your blood vessels. So it's important to keep your HDL in the normal range and keep your HDL from getting too low. The final component of the lipid panel is triglycerides. Triglycerides are another lipid that's found in the blood, and high levels of triglycerides increase the rate of atherosclerosis and heart attack and stroke. In addition, high levels of triglycerides increase the risk of pancreatitis. So it's important to keep your triglycerides within the normal range in order to avoid heart attack and stroke, and also to avoid pancreatitis. What are the causes of high cholesterol? Advancing age is a common risk factor for high cholesterol. The younger that you are, the more likely that your lipid panel is normal, whereas the older that you get, the more likely that you're going to develop abnormal cholesterol. Weight gain is another common cause of abnormal cholesterol. The more weight that you gain, especially if you are in the overweight or obese range, the more likely that you're going to develop abnormal cholesterol. Exercise and living an active lifestyle is a great way to keep your cholesterol in the normal range, but the more inactive lifestyle that you live, if you spend a lot of time on the couch or sitting at a desk or spending a lot of time in bed, the more likely that your cholesterol will be abnormal. There are some activities which are known to cause abnormal cholesterol, and these include smoking and drinking. Smoking tobacco products and drinking alcohol products are both unhealthy habits for many reasons. But one of the most important ways that these can hurt you is they can cause abnormal cholesterol. So it's important to limit your alcohol intake and to not smoke tobacco products at all. Another cause of high cholesterol or abnormal cholesterol is stress. There have been many studies showing that when someone suffers from high levels of stress or anxiety, that this can cause abnormal cholesterol. We all get stressed sometimes, but it's important to deal with one's stress in a healthy way for many reasons, including to help to keep your cholesterol under control. Another common cause of high cholesterol is genetics. If your parents or grandparents suffer from abnormal cholesterol, this increases the risk that you will develop high cholesterol as well. In addition, there are genetic conditions which can be passed down from generation to generation, which can cause extremely high levels of cholesterol. So if this runs in your family, make sure that you see your doctor and have your cholesterol tested. How do we test for abnormal cholesterol? The way that we do this is by performing a blood draw to test your lipid panel. Some doctors do this test while fasting, but I don't recommend that you fast for this test. Today, we have lots of data showing that fasting does not tend to alter the results of this test by very much. And what's more is that it rarely affects the management. So I recommend that you eat the way that you always do when you perform a lipid panel blood draw. If your cholesterol comes back abnormal, there are several diagnoses that may be used to describe your situation. These include high cholesterol, dyslipidemia, hyperlipidemia, and hypertriglyceridemia. The exact diagnosis used will reflect the most accurate situation that reflects your lipid panel results. But in all of these cases, it's important to treat the abnormal cholesterol in order to prevent heart attack and stroke. How do we treat abnormal cholesterol? The most important way that we treat abnormal cholesterol is through lifestyle changes, and these include a healthy diet, exercising, and maintaining a healthy weight. A healthy diet for abnormal cholesterol tends to be one that is very high in fruits and vegetables, and one where you're not overeating. In addition, exercise is really important for abnormal cholesterol. I recommend that you exercise at least 4 times a week, at least 30 minutes each time, something where your heart's beating fast, you're breathing hard, and you're sweating. For many patients, this may include vigorous hiking, jogging, swimming, biking, aerobics classes, weightlifting. Do what's the most fun for you, and this will help to correct the abnormal cholesterol. Another important treatment for abnormal cholesterol is to maintain a healthy weight. If your BMI is between 18 and 25, then your weight is in the healthy and normal range, and you shouldn't change your weight. If your BMI is between 25 and 30, then you're in the overweight range. If your cholesterol is abnormal, then you would likely benefit from healthy weight loss to correct that abnormal cholesterol. And especially if your BMI is over 30, then that means that you're in the obese range. And if your cholesterol is abnormal, that means that you would benefit from substantial healthy weight loss in order to correct the abnormal cholesterol. What are the medicines that we use to treat abnormal cholesterol? The most important class of medicines that we use for abnormal cholesterol is statins. There are other medicines that are sometimes used, such as prescription gemfibrozil or fenofibrate. These medicines are typically prescribed for abnormal cholesterol, especially when the triglycerides are greatly abnormal. In addition, there's a supplement that can be very useful, and that is red yeast rice. Red yeast rice you can buy in grocery stores and health stores, and red yeast rice has natural statin in them. So this can be a great way to correct your abnormal cholesterol without having to use prescription medicine. But again, the most important medicine for abnormal cholesterol is statins. There are a variety of different statins which can be used to treat abnormal cholesterol. My favorites are atorvastatin, which is Lipitor, and rosuvastatin, which is Crestor. These medicines you take every day, regardless of how you feel, and these can be very effective for correcting abnormal cholesterol. Most people who take statins don't have any side effects, but for the people who do, the most common side effect is muscle soreness. So while on this medicine, if you develop pain in both of your arms or both of your thighs or both of your calves, it may be because of the statin that you're taking, and you should talk to your doctor to see if we should adjust the dose or if we should stop the medicine and consider a different treatment for your abnormal cholesterol. How do we know which patients should be prescribed a statin to treat their abnormal cholesterol and which patients should not be prescribed a statin? The way that we do this is by calculating your cardiovascular disease risk. Whenever your doctor checks your lipid panel, your doctor can use the results of your lipid panel along with other parameters such as your age, your gender, your blood pressure, if you smoke, if you have diabetes, and other parameters to estimate your risk of having a heart attack or a stroke in the next 10 years. If that risk is substantial, then your doctor will likely prescribe a statin to help to correct your abnormal cholesterol and to prevent heart attack and stroke. That's it for today. Thanks for watching. Remember to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're having any symptoms or if you think that you're suffering from high cholesterol, make sure that you talk to your doctor. Bye-bye.